finished Tourette's this week. And so Tourette's is a disease caused by repetitive, uncontrollable movements or sounds. It's a neurological disorder, and it usually appears between ages 5 and 7. So the symptoms are something called tics, so that's repetitive, uncontrollable movements, and that you can have simple tics, which are just small muscle movements with few groups, or complex ones that are larger movements that involve many muscle groups. And before they get a tic, they'll normally have an uncomfortable sensation like a tingle or an itch in their arm. And they can sometimes withhold a tic for a time if they have put great effort into it. And so as nurses, if they come in, we can assess how often they get tics, what might cause them, and how frequent they are. And so the causes aren't exactly known. It's usually a combination of genetics and environmental factors. So it is a dominant gene, so if one of the parents has it, there's a 50-50 chance that the child will have it, and it's 3 times more common in boys than girls. And so what happens to cause the disease is it is a normal breakdown of dopamine in the brain. And so to diagnosis, there's no specific test that can determine that you have Tourette's. Usually it's just found out by ruling out other options. They usually appears before they are 18 and typically peaks around their mid-teens and then starts lessening over time as they get older. And it is usually confused with other disorders, so sometimes eyesight because their eyes will twitch, or allergies when their nose will like run or something like that. And some of the ways that they use to rule out other things such as allergies is blood tests and MRIs. There's no cure for Tourette's, but there are some medications that can help control the symptoms. So you can use medications that will block dopamine to help with the breakdown of that. And then for any like outbursts that they have or emotional factors, you can use medications like ADHD or depression medications. Something that they also use was Botox to relax the muscles so that they won't contract as often. And you can also have physical and behavioral therapy. So prognosis and follow-up. Most people with Tourette's can live long, happy lives, but the disease can often affect their self-image because normally over time it starts lessening, so it'll be more in their childhood because they'll learn how to control it, but they can get attention deficit disorder, obsessive compulsive disorder, autism, learning disabilities, sleep disorders, depression, anxiety, pain related to the tics, especially headaches, anger management problems. So basically it is controlled through education for the patient and the family and making sure that they have good support.